Discover the 10 healthy habits to prevent heart attack. Blood flow to the heart is blocked by a plaque or fatty clot, causing the heart to not work for a period of time or may result in death, or irreversible damage to part of the heart tissue. This is your health channel in minutes. If this is your first time, subscribe to the channel, turn on the notification bell and click on the like button. Preventing a heart attack is not a difficult task. With practical changes in lifestyle, such as adopting better eating habits, and practicing regular physical activity, you already reduce the risks of a heart attack a lot, but there are other ways to prevent it. Take care of your food. Currently, one of the main causes of heart attacks is atherosclerosis. This disease is characterized by deposits of fatty plaques in the blood vessels, which reduces the space for blood to pass through, and makes it easier to block. Also, the fat in the wall makes the artery more rigid, preventing it from letting go when needed. Among the necessary changes in diet, reducing the intake of vitamins and salt is one of the main ones. That's because salt raises blood pressure, which can lead to heart attacks. Therefore, choosing foods rich in fiber, good vitamins, mineral salts and protein can help you stay healthy and prevent heart attacks. Do physical exercises. Practicing regular physical exercise is one of the best ways to prevent heart attacks. Adopting this habit combats sedentary lifestyle, obesity, diabetes, cholesterol, hypertension, and strengthens the heart muscle, considerably maintaining the likelihood of a heart attack. However, pay attention to the need to see a doctor. Making cardiac estimates is fundamental, because if you have a heart disease and don't know it, certain intensities of physical exercises can act as triggers for a heart attack. With proper medical guidance, physical exercise only adds to the maintenance of your health and quality of life. Stop smoking. Smoking is one of the most important risk factors for developing cardiovascular disease, as some chemicals in tobacco, such as nicotine, can damage the heart and blood vessels, leading to narrowing of the arteries, called atherosclerosis, or the formation of blood clots, which can lead to a heart attack or stroke. Also, the carbon monoxide in cigarette smoke replaces some of the oxygen in the blood, increasing blood pressure and heart palpitations, forcing the heart to work harder to provide enough oxygen. So as a heart attack prevention measure, quit smoking and avoid other diseases such as lung cancer, mouth cancer, and more. Regular doctor appointments. The best way to prevent a heart attack, like any other disease, is intervention, before the event actually happens. The heart attack usually gives signs, days, weeks, or months before it happens. At that point, regular exams and checkups can be extremely important to prevent. Visiting the cardiologist at least twice a year would be enough to see how your cholesterol, triglyceride, obesity levels are, and whether there is any disease developing, capable of being a risk, or a contributing agent, for the heart attack. In cases where there is a prevalence of heart disease in the family, it is recommended to redouble care, given the high possibility of being affected by an acute myocardial attack. Control hypertension. Hypertension, or high blood pressure as it is popularly called, is one of the main causes of death in the world. And it is one of the major agents that cause a heart attack, since hypertension causes a tightening of the vessels, extra effort of the heart muscle, so that it can pump blood. Over time, if this situation is not controlled, overload occurs and muscle wear, culminating in a heart attack, stroke, kidney failure, among other serious problems. Control your cholesterol. The first thing you must have encountered when looking for how to prevent a heart attack was certainly the danger of having unregulated cholesterol. Cholesterol in the human body is very important, of great use for the cell membrane, production of vitamin D, production of sex hormones, and several important for the proper functioning of the organism. However, when its percentage in the human body is high, what used to be an ally, can become an infarct-causing agent. Prevent or control diabetes. Diabetes is a chronic disease that is increasingly present in people's lives. With diabetes, the blood tends to become viscous, moving at a slower speed through the bloodstream, leading to the appearance of clots. Another worrying point is the use of insulin, which inserts glucose into the cells, also causing relaxation of the arteries, and as the hormone does not work properly, there is an increase in pressure. Therefore, if you are already diabetic, take care of your diet and do light exercises. If not, try to prevent it by adopting healthy habits and reducing sugar and carbohydrates. Maintain ideal weight. Excess weight is associated with high blood pressure, high cholesterol, or diabetes, increasing the risk of cardiovascular disease such as stroke or heart attack. So even a small amount of weight loss can help lower blood pressure, lower blood cholesterol levels, or reduce the risk of diabetes. In this case, heart attack prevention and obesity is changing habits, such as choosing healthy foods and exercising. Sleep well and reduce stress. People who don't get enough sleep have a higher risk of developing obesity, high blood pressure, heart attack, diabetes, or depression. Therefore, adults should get about 7 to 8 hours of sleep a night, and should go to bed and wake up at the same time every day. Stress, on the other hand, can make the heart beat faster, increasing the number of heartbeats per minute and make the arteries and veins harder, reducing the flow of blood. In this way, it is important to avoid being stressed, through relaxing activities, physical activity, and leisure time. Drink alcohol in moderation. The consumption of alcohol, in small amounts, and sporadically, is not enough to cause a heart attack, but the problem is consumption beyond the recommended and in the long term. The recurring habit of consuming large amounts of alcohol harms heart health, triggering heart failure, stroke, hypertension, and heart attack. The acceptable recommendation is that men drink up to 2 glasses of 100 milliliters per day, especially red wine. For women, 1 glass is the maximum recommended, as red wine has a substance called resveratrol, which is generally good for health. It is worth remembering that these portions are acceptable estimates. Each person has an organism, which needs an individual evaluation. It is important to emphasize that there is no age for a heart attack to happen. Therefore, young people with multiple risk factors for cardiovascular disease, and a family history of this disease, should seek medical help when they notice the symptoms. Heart attack is an emergency that requires medical attention as soon as possible. Identifying the symptoms can be decisive in saving the life of a person suffering from a heart attack. When the first symptoms appear, call for help or go to a hospital immediately. The longer the delay, the greater the risk. If you are helping someone with a suspected heart attack, take some precautions while waiting for medical help. Prevention is always the best medicine, so changes in our lives are essential. It is important to remember that healthy lifestyle habits not only prevent heart attacks, but also other health problems. Following prevention recommendations after treatment is essential for anyone who has already suffered from a heart attack. By this, all caution or little. I hope you liked it and click on the like button, subscribe to the channel, turn on the notification bell, and don't forget to share the video with your friends and family.